When I started billing back in 2006, deductibles were a really simple and easy concept. The patient had a deductible, they had to pay it out of pocket first before the insurance company would pay, and then they would be responsible for a copay or a coinsurance. It was simple as that. Nowadays, however, these policies are ridiculously complicated. Some things apply to the deductible, some things don't, and you as the medical biller need to know what should apply and what shouldn't apply. So it is deductible season, and I'm here to let you know all you need to know about deductibles. So keep watching. So what is a deductible? According to CMS, deductible is an amount you could owe during a coverage period, usually a year, for covered healthcare services before your plan begins to pay. Now we're going to break that definition down just a little bit. So CMS is the Center for Medicare and Medicaid Services, if you didn't already know. Their definition of deductible is pretty much, I guess, the standard of the definition for deductible. And because with CMS, you have to meet your deductible before they start to pay for services, that's the definition that they use. However, other commercial policies are different. Also, they specified in the definition coverage period, which they say is usually a year. And most of the time, your coverage period is usually a year. But there are some policies that are less than a year. It can be maybe 6 months. So a coverage period is not always a year, but it's usually a year. And then the next thing I want to point out is for covered services. So if a service is not covered under the person's plan, the deductible doesn't apply because now the insurance is not even going to pay anything. It's not a covered service, it's non-covered. So it doesn't apply to any of the deductibles, the copays, the coinsurances that the patient may have responsibility for. So how does the deductible work? So I wanted to start off by saying that not all deductibles are the same on each policy. And let me see if I can explain that a little bit better. Deductible means the same thing, that the patient has to pay that amount out first before the insurance pays. But it doesn't always apply to all services. The way the definition is read or the way the definition is stated, it makes you believe that if a patient has a deductible, if I have a $500 deductible, that before my insurance pays anything out, I need to meet that $500. However, not all policies are like that. I might have a policy that says I have a $500 deductible, but if I do an office visit, if I do labs, if I do other things, that does not apply to my deductible. So first of all, not all policies are the same. Then there is individual and or family deductibles. So as for me, I am the only one under my policy, so I only have an individual deductible. But there are some patients who have a family deductible. They may have an individual and a family deductible. That can get a little confusing because you may have met your family deductible but not meet your individual deductible, or you may have met your individual deductible but haven't met your family deductible. So if an individual who is on a family policy goes into the provider's office and they have met their individual deductible but not met their family deductible, they will not have to meet their family deductible in order to, just pay their coinsurance. They have already met their individual deductible, so they are fine. However, if that same individual hasn't met their individual deductible, but has met their family deductible, then again, they don't have to meet their individual deductible because the family deductible includes everybody. Then you also will have low and high deductibles. Now, I have seen deductibles from $100 to $10,000. As time goes on, the deductibles get higher and higher and higher. Patient responsibility gets more and more and more. My deductible personally is $5,000. So they can be a lot at times, but the deductible depends on your premium. Not only your premium, but it has something to do with your premium. So most of the time, when you have a low deductible, you're paying a higher premium. And if you have a high deductible, you're paying a lower premium. So your deductible can apply to some things or it can apply to everything. So if a patient has a deductible that applies to everything, then that means regardless of whatever they have done in the physician's office, they have to meet their deductible first before the insurance pays. But if the deductible only applies to certain services, there may be a policy that says you can have specific office visits, maybe laboratory, whatever, and that doesn't apply to your deductible. But if you have surgeries or procedures or radiology, then that does apply to your deductible. And most importantly is that deductible is the patient's responsibility. Now, both you as the provider or the biller in the office and the patient has signed a contract with the insurance company. And it's stating that the providers need to collect the patient's responsibilities and the patient needs to pay the patient responsibility. So sometimes patients get confused about why they have to pay more money when they're paying a premium every month. But premium and deductible is completely two different things and they need to understand that. So let's give an example. If a patient has a $250 deductible that applies to procedures, to hospital surgeries, and to radiology, and they have met $50 of that deductible, there's a $40 copay and there is a 20% coinsurance. Now, the patient sees the provider for an office visit that's billed at $275. They are scheduled then to have a surgery in the hospital as an outpatient, and that surgery will be billed at $1,625. How much do you charge the patient for the office visit and for the scheduled surgery? So I'm going to give you a little minute to think about that. Put your answers down below, and then I'll let you know what the answer is. So if you said $40 for the office visit and $485 for the surgery, then you are correct. In this example, the office visit does not apply to the deductible. So the copay for the office visit applies, and that is $40. Then for the scheduled surgery, the deductible does apply, but the patient has met $50 of that deductible. So there's $200 left to meet of the deductible. So you're going to subtract the $200 from the $1,625, which is the billed amount, multiply the balance by 20% because that's the coinsurance after they have met the deductible, and then add back the $200, and that gives you $485. So which areas in the physician's office need to know about the deductible? So there are two areas that need to know about deductibles. And the first area is the front desk, whether that's check-in, check-out, whomever, the front desk needs to know about deductibles. And they need to be the people who deal with the verification. So before the patient comes in, they need to verify coverage, check the benefits of the patients, which would include all the deductibles and copays and coinsurances and all of that stuff. So the front desk needs to know about the deductible so they can know what to tell the patient. They also need to know how to answer questions because there will definitely be patients that have questions about what the deductible is, why are they paying it, and they need to know how to explain to the patient clearly what the deductible is and why it's important that they pay it and why they need to pay it. Not just, oh, you should know that you need to pay your deductible. That's not going to cut it. Then they also need to know about payment collections because when a patient has a deductible and it hasn't been met, the front desk needs to collect payment in advance. When a patient has a service and they've already done the service, sometimes they forget about paying and they're already set and ready to go, so they don't want to have to deal with that. Now, a medical biller also needs to know about deductibles. And that's because they too will also get patient questions. So if for some reason the front desk did not collect enough, and when the claim is billed and the insurance paid and there's a balance, then the medical biller may have to send out statements, which is the second thing. So you send out these statements, and you need to first make sure that in sending out the statements, they are correct, that what you are sending out to the patient and what was applied and not applied to the deductible is correct. So you need to know that first. Then after you send out the patient statements, patients might call you and ask you questions again. Why am I getting this bill? I paid this certain amount, or I didn't have to pay this certain amount. Why am I getting a bill? So as a medical biller, you have to be able to explain to them what deductible means and all of that stuff. I always say maybe they should have gotten this education, because patient needs to be educated on their insurance, but we don't have a lot of that, and a lot of patients just don't understand. Now let me give you 5 tips to a successful deductible season. And the first one is to always, and I mean always, verify benefits. I don't care if the patient is coming into your office every single day. You need to verify benefits every single day. And even in doing that, there's probably going to be some hiccup. But to have a successful deductible season, verifying benefits will help you determine whether or not the patient has a deductible, whether they have met the deductible, how much was applied to the deductible. Now, most likely, the front desk would be verifying the benefits, but sometimes medical billers also do that. And if you are one of those medical billers, you need to make sure that you always verify every visit's benefits. The second thing I would do is I would inform the patients of what their responsibility is. Giving the patients a heads up on having to owe money will be able to get you more money. They won't come in unprepared and not know that they have to pay anything, and then it will be a whole fiasco. Either you might have to reschedule an appointment, or they already went in and they didn't pay anything, and coming back out now, they're like, I don't have any money. You can't take back the service after that. So you need to make sure that you prepare the patient and let them know in advance that they have a deductible. Number 3, you should collect the patient's responsibility at the time of service and do it as accurately as possible. Now, again, all of these things sometimes can be an estimate, and we're not guaranteed, or we're not totally sure what the insurance will pay, but try to be as accurate as possible so that you don't then have to go in the back end to send out statements or call up patients and have them pay you after they've had their service already. 4 is to be prepared to educate the patient. Don't just leave the patient out in the cold, and when they ask you questions, you give them an attitude. You don't know what they're talking about or why they're asking you, or they should know. Don't do that. This is your patient. You want to help them out as much as you can. So if a patient has a question, be prepared to educate them. You should know what deductible is and all about the deductible, so that you can then explain it to the patient. That would then help you get paid for the services that's provided by your provider. And last but certainly not least, number 5 is to have different payment options. If you can have all the plethora of ways to take payments, cash, credit card, money orders, checks, online, over the phone, give them options. Even having a payment plan is an option, because you want to make sure that the provider is getting paid for the services that they are rendering, and that the patient is also happy, so that they don't feel limited and having to scramble and try and figure out how they're going to pay you for their medical services that they need. So be sure to watch this video next if you want to learn all about patient responsibility and what you need to know as a medical biller. See you again in my next video.